I'll be making a presentation on cybersecurity-enhanced gain-based learning for clinical decision-making, a comparative study. I'm a PhD candidate of the University of Alabama. My research interest is in the area of security and the application of IT to complement health processes. I'll be looking at this topic from the aspect of cybersecurity and the aspect of clinical decision-making, the aspect of health. What are the list of keywords we're going to expect from this? Include the game-based learning, the clinical decision-making, and the cybersecurity education. As a form of content we're going to make use of here, we'll make use of we'll be having the introduction, the related works, the methodology, the discussions, the future works, and the conclusion itself. As a form of introduction, game-based learning have found itself in so much relevance in the aspect of education. It incorporates game elements, make things and dynamics into education, and it aims to engage learners to improve their learning outcomes. It has also shown promising results with studies indicating that game-based learning enhances motivation, engagement, learning outcome, and retention. It has shown its importance in the area of teaching clinical decision-making, especially in healthcare. It has also found its significance in other healthcare settings, especially in the aspect of evidence-based practice that requires healthcare professionals to make informed decisions based on their best available evidence and effective in carrying out effective clinical decisions. As a form of introduction, what are the objectives? One of the objectives is to assess the effectiveness of game-based learning in enhancing the decision-making abilities of medical professionals. The second objective is to focus specifically on clinical decision-making and its relation to cybersecurity challenges. Now, how has game-based learning found itself effective in education? The use of games in classrooms is known as game-based learning. It has been shown to be an effective method of instruction. Clinical decision-making itself is a process by which healthcare professionals make choices about patient care based on the available information and clinical expertise and patient preferences. It involves weighing the risk and benefit of different treatment options and arrive at the most appropriate course of action. Now, what's the relationship between cybersecurity-related decision-making and game-based learning? Cybersecurity education can be improved through the use of games and learning theories that create an environment that is immersive, adaptive, and interactive for students. If you look at the objectives, you are going to have, you are going to be able to measure these objectives. And how will we be able to achieve that? We are going to have a methodological approach such that we have to bring out the 200 medical professionals from renowned institutions, whereby we divided these medical professionals into two groups. One is the experimental groups, those that will be made to go through the game-based, that participate in game-based learning, while the other group will not be made to undergo such training or the game-based learning. So I'll be able to compare both parties. We also, this enabled us to conduct a pre and post test to evaluate the decision-making abilities of both sides, the experimental group and the control group. We used with the intervention, we exposed the participant to MediSim Clinic, that's the online game-based learning platform, whereby we collected quantitative data through use of online questionnaire and qualitative data through semi-structured interviews. What are the related works that have been done in this area? Now, the related work has to do with the fact that use of game-based learning has posed as fun and competition of games that makes students to be solely involved involved in their education. Game-based learning has been also be an effective tool that enhances clinician decision-making in healthcare. A systematic review of various games have been carried out by different researchers. Some researchers also developed a serious game they call Cyber Detective for teaching cybersecurity risk assessment and decision-making in healthcare organization, where the study involved 57 healthcare professionals that played the game and also completed a pre- and post-test questionnaire, where the results showed the significant improvement of the knowledge and attitude and confidence of those that were involved in the game. The cybersecurity education can be improved through the use of games that incorporate learning theories to create an environment that is interactive for students. Now, in carrying out this research, the methodology section is what we are going into right now. Now, what are the research questions? Research questions are three here. The first one is, how effective is the game-based learning in improving clinical decision skills, including cybersecurity-related decision-making, compared to the traditional teaching methods? The second question is, what is the relationship between engagement with game-based learning, especially in cybersecurity scenarios, and the improvement in clinical decision-making skills? The last but not least question here, what are the attitude and perceptions of healthcare professionals towards game-based learning with focus on cybersecurity-related decision-making? These are the questions that the research intends to answer. And how do we intend to go about this? We carried out an online questionnaire whereby the two groups were divided into two parts, whereby we have using the inclusion criteria and the exclusion criteria as the case may be. Now, looking at this, we have the demographic information or the social demographic information as you have here, whereby the participant, the game-based learning group, the 100, that's the experimental group, those that were made to go through the game itself. Then the control group, they did undergo the training itself. Look at you can see the age. The mean age is 34.6, which involves both gender of male and female. Their years of experience, the average is 6.8 and 7.2. Previous game-based learning, 68 and 60. The total participants, they are 200 in number. Now, looking at this, we have the question statements which produced the survey results. The game-based learning platform was engaging. We have a mean of 4.2 with a standard deviation of 0.9. The second statement here is that the game-based learning platform was easy to use. We have a mean of 4.6 with a standard deviation of 0.7. The game-based learning platform was informative. We have a mean of 4.4 with a standard deviation of 0.8. Now, looking at the paired test, as you can see here, you can see that the two groups, the game-based learning group, that's the experimental group, those that were made to undergo the use of the game, while the control group, they were not the participant, they didn't participate in making use of the game at all. Looking at the pre-intervention mean, you can see that the pre-intervention mean is 3.8, while the post-intervention mean is 4.7, which means that there is an improvement in it. Before they went through the intervention, the mean was 3.8. After the intervention, we got 4.7 with a p-value of 0.01. And looking at that of the control group, we have 3.7 before the intervention, 3.8 after the intervention. You can see it's not significant at all, from 3.7 just to 3.8. But if you look at that of the game-based learning group or the experimental group, there was a great shift from 3.8 to 4.7. So what can we say from this? It shows that And the p-value of less than 0.001 shows that the experimental group showed a significant change in the decision-making from the pre to the post-test intervention. Why, if you look at this value, the p-value here of 0.335, it shows that the p-value has no significant change in the decision-making because they didn't undergo the intervention. It shows that there was no significant improvement in their competence in the aspect of what clinical decision making. Now, looking at the regression model equation, you can see the beta, which represents the coefficient of the predictor variables, while S1 represents the age, which has to do with the CDM is the dependent variable, while the age, the years of experience, and the likes are the engagement score, the usability score, informative score, and the likes. They are the independent variable. Now, if you look at the multiple regression model summary here, you can see that the R value is 0.855, while that of the R square is 0.731, while the adjusted R square is 0.742. The adjusted R square of 0.742 means that 74.2% of the variability in the dependent variable is accounted for by the predictor variable, which is significant, which is far more than half, as you can see there. We know that the adjusted R square is used as a measure of the proportion of variance, which is explained by the predictor variable in the regression model, which we can see from this place, which is 74.2% or 0.742 as the case may be, which means that the variability in the dependent variable is accounted for by the predictor variable in the regression model. The R square itself, which is 0.731, is the coefficient of determination, which is explained by the regression model. For multiple regressions, we know the R square increases or remains the same as we add new predictors to the model. The adjusted R square only increases if the newly added predictor improves the model predicting power, which determines the goodness of fit. Now, looking at the regression coefficients, we can see beta 1, beta 2, beta 3, beta 4, beta 5, and beta 6. We can see the level of significance of each of the parameters here. Now, based on this, what's the discussion we have from this? It shows that it shows the implication of the result on cybersecurity education. It shows that the results findings hold significant ramifications for cybersecurity educations within healthcare. So what we'll be able to get from this, our deduction from this, is the fact that cybersecurity education, use of game-based learning, has a very significant improvement in clinical decision making. And that's been able to answer our 3 research questions, and if it has any role to play in the aspect of clinical decision making. In carrying out this research, there's some limitations which has to do with, 1, the sample size. The sample size we made use of 200 and dividing both groups into 200 and 100. In future research, there may be needs to have a larger sample size. Then the second limitation is generalizability, and also self-selection bias and a short-term follow-up period. There may be a need to do a longer follow-up period. Maybe after some time, we'll come back and test the intervention group again to see if they'll be able to recall what they've learned before from from the intervention study, but these are some of the limitations in this study. What are the future works that we can get from this? What are the future works we can get from this? We can, as I talked about before, now larger sample size, a long-term follow-up period, and there will be a need to compare different game-based learning platforms with other learning platforms, so I'll be able to know some of the shortcomings of each of them and create room for improvements. Also, there's also a need to examine individual differences in terms of the technological approach of each individual towards the game itself. The next has to do with the ethical considerations. Ethical considerations have to be considered in terms of the future works, the case may be. Now, what's the conclusion of this? The conclusion is that we'll be able to deduce that game-based learning enhances clinical judgment among health professionals based on the analysis that was carried out, based on the statistical evidence that we have in values, that game-based learning enhances clinical judgment among health professionals. Another conclusion we've been able to draw from this is that healthcare professionals that are engaging in game-based learning, that they demonstrated improved competence in handling complex clinical scenarios and boosted their confidence in decision-making compared to those that were in the control group that did not take part in the intervention itself. Another thing we can draw from this is that there's the need to integrate game-based learning in the medical education itself, as it will heighten students' engagement and improve their knowledge retention and cultivate the critical thinking ability, especially in solving problems. Another thing we can deduce from this is that we are able to acknowledge the availability and the effectiveness of game-based learning based on individual learner and specific learning goals. This has to do with your aim, what do you want to achieve in your learning goals. So this has to do with the variability in the effectiveness of the game-based learning. The next is what? Emphasis on the need of tailored game-based learning interventions, not just a general game-based learning. It should be tailored to where the specific needs of the student or of the professionals, so that it can be of great benefit and of interest to them. Also, there's a need to call for further research to identify the most effective game-based learning methods for enhancing clinical decision in the medical practice. The next is to highlight the importance of exploring different game-based learning platforms by identifying their pros and cons and the optimal implementation strategies that will enhance healthcare education. There's a need for advocates for adapting game-based learning to medical education to create more engaging and beneficial learning environments for medical professionals and patients alike. I'll stop at this point in time. If you have any question, I'll take it within the next few minutes. Thank you very much. This is my email.